I had a question in my DMs about whether a woman should have babies first, be pregnant, or have a DIEP flap first. And there's really two main things to think about. The way we do DIEP flaps now, we spare as much muscle as possible. Oftentimes we don't take any muscle at all. But in order to get to the blood supply of the flap, we do have to root around in your muscles. So we are cutting the muscles, and oftentimes we are damaging the motor nerves that supply the muscles. There haven't been good studies on the amount of muscle function that returns after a DIEP flap. So even if you have your DIEP flap and all the muscle is spared, there's not good studies looking at the functionality of that. And then you get pregnant. And when you are pregnant and your belly is expanding, it puts a lot of stress and strain on that muscle repair. That's often why women in second, third, fourth pregnancies show more, because their muscles have been stretched with those prior pregnancies and they're just not as strong as they were before. So could you damage your muscle repair after a pregnancy? Probably not, unless it was very soon after the flap, but your belly just wouldn't be able to hold in the pregnancy as much, if that makes sense. The second thing to think about is more of an aesthetic consideration, and that is many women after pregnancy have a little bit of extra tummy fat, and that's great for breast reconstruction. Some women before pregnancy don't have any fat at all, so having pregnancy, being older, it might actually make you a better candidate for a DIEP flap. Now, this is very, very individualized. If I have a young woman who comes in, has enough belly fat for a DIEP, says maybe kids sometime in the future, but I don't know, then I'm okay proceeding with a DIEP flap. But if someone is considering having kids imminently in the next 6 months to a year or 2 years, I really do think it's better, if possible, to delay your reconstruction with the DIEP flap and have your pregnancy. You could have implants, you could have some type of other temporizing procedure like a Goldilocks, but it might be better to delay the ultimate autologous reconstruction. Does this make sense? Let me know your questions in the comments.